here we are. We're all about the facts, not fear. Welcome to our new weekly cast. I have the amazing Heather Butts, who I'm so lucky to have join me. How are you, Heather?
Hi, Tom. How are you doing?
I'm doing good. I'm doing good. We already have a whole bunch of people tuning in. I think this is going to be a really good thing. So, if you don't know what this is about, let me explain it to you. What we're doing today is we're going to be comparing the COVID virus versus the Spanish flu is how we're going to start out. We're going to talk a little bit about that. But we're also going to take tons of questions from everybody out there. And we're going to put up some memes and some social media posts that people have put up. And we're going to give you the real facts behind some of that. So this is all about facts and not opinion. So, Heather, just in case they don't know you, who's tuning in, because we have a bunch of new people, give them a little background. What is your background?
Sure. So I am a public health professor. I study epidemics and pandemics and epidemiology and public health law. That's what I do for a living. My educational background, as people know, I think you've seen it, is I went to Princeton undergrad and then I went to St. John's for law school. I got my public health degree at Harvard in law and public health and a master's in education.
There we go. So now you have a little bit of her background, but that's not what we're going to focus on. We're going to focus on a lot of the facts today and how everything history does seem to repeat itself. So back when we first started talking about March 18th, I believe was the first time we chatted.
That is correct. That was our first talk about COVID-19.
Yeah, before it ever really took off. And then we got lucky enough to touch base on it again. And now during that first talk, we mentioned how I felt like there was a similarity to the Spanish flu. Why don't you explain to everybody what COVID is as a coronavirus and what the Spanish flu was as in H1N1, or what we already know as the flu?
Okay, right. So actually, you're the reason why we are focusing on Spanish flu, and I think it's a really good place to focus. And you actually focused on that back in our telecast on March 18th. You mentioned it, and then you asked some questions about it. And at the time, I even said to myself, this is probably a good path to go down. And so I'm glad that we're doing it. So COVID-19, the COVID-19 stands for COVID. CO, corona, VI, virus, D, disease. 19 is when COVID-19 manifested itself. That's why we call it COVID-19. The Spanish flu, also known as the flu pandemic of 1918, although, Tom, as you and I have talked about several times, it really should be sort of like the flu pandemic of 1918 through circa 1920.
Years, people.
Yeah, exactly. It was years. It was a very long time. And by the way, as we'll talk about with COVID-19, with coronavirus, even once you get the numbers to be super low, it's not as though it's gonna completely disappear from our society. That's not how any of this works. Didn't even work that way with H1N1. So yes. Also known as the Spanish flu. So yes. The Spanish flu actually is called the Spanish flu mainly not because it was any more rampant in Spain than anywhere else, but because and I don't even know if we talked about this, but of the reasons basically why it's called the Spanish flu, a really good reason, because obviously 1917, 1918, 1919 was World War I, and Spain was actually a country that was not involved in the war in the same way that other countries were. And so the Spanish media felt very comfortable to talk about the rampant nature of this flu pandemic because they weren't concerned about the backlash that it would cause if other nations knew how rampant the disease was and what a problem it was for soldiers. So the Spanish flu, the name Spanish flu, doesn't connote that Spain had any way worse of a flu pandemic than any other country. It's just the media in Spain talked about it more than other countries.
Yeah. I'd like to reiterate that Spain isn't necessarily where it started. It actually was just free press there, where other countries had wartime censorship. So the
Correct.
control of the media was what made it get called the Spanish flu when it didn't even originate in Spain. And then now 100 years later, now that we're learning about it 100 years later, that it's almost a repetition, it wasn't even the Spanish flu. It was actually frontline France, I think. I'm not positive, but
it was there. So possibly France, possibly even Kansas, little town in Kansas, also potentially might have been. But you're right. But to your point, to your very salient point, it was not Spain. Spain was just the one that talking about it. But the Spanish flu, the derivative of it was an H1N1 flu, which is something that, again, we talked about this too before the broadcast. It's really, really fascinating to me that people like poo-poo the H1N1, like that wasn't a thing. Except it killed millions and millions of people in 1918. And then it sort of had a resurgence, obviously in the 2000s, and even a little bit before that. But it is an H1N1 avian flu derivative.
Yeah, and all of those flus, I feel like all of this is really just they mutate. It's constant. There's a constant change, so it evolves and changes through time. And that's really that's what we're here to talk about. I found some of the similarities crazy. I want to bring up this picture which you brought. So you would think that this would be an ad from today, but prevent disease, careless spitting, coughing, sneezing spreads influenza and tuberculosis. Luckily enough, we've gotten rid of tuberculosis, so that's where you date this advertisement. But this is from what year?
1918.
1918. That's so crazy, right? And then the one that I put up originally, where it says wear a mask.
It could completely be from today, couldn't it?
Absolutely. A gauze mask is 99% effective.
Some of this ad has better stuff on it than some of the ads I see from today.
That's what's crazy, right?
Yeah, it's got some like decent stuff on it.
I agree. So when we start looking at these things, when people are saying, "Oh, this has never happened before," 100 years isn't really a long time. Like some of us have family members that have lived, were born probably right around the time of the Spanish flu, and now we're still around now.
Yep.
But
no, not a long time at all. It really isn't.
Yeah. So I'm going to let you get into a little bit more of stats and such as well. So I know you have some very, very, very interesting statistics, and you just let me know what you want me to bring up, and I'm happy to bring them up. So
I think we should start with the numbers that look at the prevalence of the COVID-19 by state.
State by state. Okay.
I think that's interesting. What do you think?
No, I like that. Let's start there. I feel like we're new cases.
You did a nice job with this.
Thank you. I appreciate that.
Okay, so, great.
Where new cases are mostly the same. The growth rate of the virus has appeared to slow in some states with a high number of cases, but a lack of widespread testing may mean the cases are being undercounted. So go ahead. You can give where new cases are decreasing. Luckily enough, New York and New Jersey both fall into the decreasing states.
Correct. So these two sets of stats, I think, are instructive for us. So this is from today, May 5th. And it looks at where new cases are mostly the same. So you can see, and I mean, mostly the same doesn't mean that there's no increase or decrease. It just means, with in sort of a statistical number that we care about, there's not much of a difference from, a couple of days ago and now. It's pretty much static at this point. And we don't expect there to be much of a change going forward. So that's new cases are mostly the same.
But now this is under the premise of under these conditions that we're in, where we're socially distancing. And I know that there's breaking news, and I don't know everybody in Jersey that's tuning in. that Governor Murphy extended another 30 days to the social
Correct.
distance. I think that's going to happen in New York too. I feel like I don't think we're opening on the 15th. If Jersey did it, isn't there some sort of a joint force in the tri-state area?
Tom, legit. Like one day, people are going to come on here, and there's not going to be a me. It's going to be the Tom show. You are correct. That is correct. Very well said. Yes. So there's a consortium of 7 states. New Jersey is one of them. New York is one of them. Interestingly, when we go back to that graph, you will notice that there's several states on that graph, the graph of states that states where the numbers are decreasing. New York, New Jersey, Massachusetts, Delaware, Connecticut. Look at that. 5 of the 7 states that are part of this. Oh, Rhode Island. Yeah. So basically all the states that are part of this consortium of states that are banding together to do social distancing and so forth, they happen to all be on the list of states that are on the decline. Band together. Okay. So yes. So New Jersey, it's interesting actually. New Jersey is actually a state that I would actually say has had more restrictive measures than New York. I specifically remember the day. It was a Saturday. In March. I remember the day when New Jersey actually implemented their stay-at-home order and their curfew. And I remember actually being sort of like jarred by it.
Taken back by it. Yeah.
Whoa. Like that's the only other thing that stunned me that much is when I was watching the NBA game that stopped mid-game. And I thought to myself, this is real because the NBA just stopped the game in the middle of a game. So that really sort of stopped me with what New Jersey did because and it was a Saturday. So I remember thinking like people got to get home. They better hurry up and, do what they're going to do and then get there. But Jersey actually has been, I would say, a lot more restrictive in terms of its measures in some ways than New York. They have a curfew. They had a very strict stay-at-home order. Their governor has been very proactive about the orders that he's put in place 30 days in advance. So his orders have been in 30-day increments as opposed to New York, where it's more like, every 14 days and we get another 14 days. So yes. So as of today, the order for New Jersey to be essentially in their persistent lockdown state continues through June 5th. That's another 30 days. But the measures, as we've seen, are taking effect because New Jersey is one of the states that is on the decline. But New Jersey, but make no mistake, I would say New Jersey has one of the more restrictive policies in the entire country.
Really? The entire country?
Oh, yeah.
I know people freaked out when they said when they instilled a curfew. So there's a lot of people that are getting leery of big government and being. These are some of the things that we want to address with all the social media forums, right?
New York doesn't have a curfew. New York has no. If I wanted to, what time is it now? If I wanted to get off the cast in 15 minutes and start traipsing down the street, nobody's gonna stop me. But New Jersey has a curfew, so sure.
Absolutely. I have a lot of comments pouring in that I don't know why they're not filtering into our main screen. So if you want to make a comment so I could address it, if you jump on the YouTube, that's probably the best way for me to see it. Mm-hmm. But I'm happy to push it through. Jared actually asked her to address how the cures being utilized speed up the multi-system organ failure. Yes, we need to open, but people need to see the horrors we see in the hospital. I don't really want to address the horrors and fears, but that's somebody. Jared actually is another player that works in the medical field. So he's been
Jared. Do I know Jared?
JD, you might. He's played with us for a long time.
Okay.
But I think we're trying to stay away from negative and fear and just give people some solid stats, not really making it bad.
One thing I will say about Jared's comment, though, as somebody who has several family members in the medical profession, is just, and Tom, you and I have talked about this a little bit. My concern my concern for medical professionals is on the other side of COVID-19 with issues like post-traumatic stress and depression, which I'm sure some people are feeling now. So I think it'd be helpful. And I'm going to write, I have a new notebook, everybody. Remember,
brand new notebook.
My old notebook is done and dusted. It's finished. I have no more pages left. So I got myself a new notebook, a new down to the felt COVID-19 notebook. And I'm going to make a note of Jared's comment because I know we talked a little bit about talking about some issues down the road having to do with just, what people have seen and what they've experienced and trauma and so forth. And so I would like to make a note of his comment.
And start collecting a little bit of that data.
Yep.
I agree. Tim Moulton chimed in and he said, as an expendable employee, I mean essential, how come I haven't gotten it yet? So his question is, why hasn't he gotten it yet?
Well, Tim, my friend, how are you? How are you, buddy? Tim, by the way, who's although at some point soon I need to see from social distance Lucy, because she made a very kind offer to me for some items to donate. So Lucy, if you're watching, I will see you soon. But as the only human being in the league that I've physically seen since COVID-19 started, that is Tim. I think your question is super interesting. So I have a couple of theories as to why you may not have gotten it yet. One could be potentially that you have an immunity to the disease. Why do you have it? There could be several reasons why you do, and we could sort of think through those. I mean, with the obvious being that you potentially had the disease at some point, and now you have built up an immunity. That would be, very a good thing. Sure. Another could be that you have been practicing really fantastic social distancing. The 2 times I saw you, you did a great job of it. You were very careful and we kept our distance from each other. So that certainly could be a reason. You're a very careful guy and you take things seriously. So that certainly could be a reason. The third could be that when you are around other people, you just have safeguarded yourself and you're very careful about hand washing and using hand sanitizer and using a mask and so forth. That could certainly be another reason. So there's some reasons why we can think. Yes.
I'm getting so many comments. So Tim Moulton's like a machine gun of comments right now. So he said, sunlight kills it in minutes. Is that a fact?
Well, we don't know that exactly to be true. So one of the things I think people are hoping for is that UV rays kill it, sunlight kills it. That if because it's summertime, it won't exist anymore. We don't know any of that to actually be definitively true. And I'll be honest with you, I wouldn't bet going outside and, no offense, Tom, going to play, like
Poker.
a couple of hands that raise the bar on the fact that sunlight is going to kill it if I go outside and play, in the outside part of Raise the Bar. I love Raise the Bar. I love the people there. But I wouldn't bet that. And I basically would say to anybody on this call, how many of you would be willing to take a chance that sunlight kills a virus and hop on out there and start living your best life? I think a lot of people would have a little pause around that. So,
I agree.
And Tom, we talked about the fact that the pandemic of 1918 had some big blips.
Let's touch base on that, because Tim actually chimed in and said there's no comparison to the Spanish flu. What is your feelings on that, Heather?
Oh, there's lots of comparison, and we should be making them. Let's go, Tom.
Let's go. Let's step it up. We're obviously not doing our job.
We're ready. We are ready.
We are. So let's give the charts. This is the chart from the Spanish flu.
Right.
So
Yes. Okay. So the thing about the Spanish flu, which is super interesting, and Tom, I will ask you this question, and let's see if you can answer it. I think you can. What was a big factor with the prevalence of the spread of the Spanish flu between 1917, 1918, and 1919, 1920? What was the big factor?
Okay, so the war had soldiers leaving their homes, going to war, and then returning home to their small towns and areas. When 1918, people weren't flying for pleasure.
Correct.
So now we fly for pleasure. So that's the only reason I think that there's such a good correlation between the two, is because
Correct.
we were moving people across the world in airplanes, when now we do it for fun, and at the time they were doing it because it was wartime. So that's why I think it made a good model for what we're looking at right now.
Well played. You get your public health certificate, my friend. That is correct. Right. So the correlation, the actually very, from a public health perspective, very helpful correlation between the 1918 pandemic and the COVID-19 era, even though they're 100 years apart, is travel. And the fact that, unfortunately, for us during the Spanish flu, you had a lot of people traveling around the globe. It just happened to be that they were traveling for war. Right. They weren't on pleasure cruises and they weren't on pleasure trips, but they were traveling, and they were traveling a lot. And so that's why we see these blips, essentially because you had soldiers from, and actually one super interesting possible way that this spread is a little town in Kansas, or a little county in Kansas called Haskell County, which is thought to be potentially one of the inceptions of the flu of 1918. And if we take that as being a possibility, there were 18 cases of the flu in Haskell County in 1918, and there were 3 deaths. And then there were several young men from that county who enlisted in the wartime effort and then went overseas to fight in that effort. So you just take that one county, and we don't know that is even where that was the inception of the H1N1 flu of 1918, but it's a decently helpful correlation to COVID-19 because really no other time in our history other than wartime, before the modern era of airplane flight, do we have individuals quickly getting from one part of the globe to the other than a wartime effort, which is why it makes a lot of sense why the flu of 1918 has such correlations to the pandemic of 2019/20.
So Tim also chimes in, and he said he meant it's a different time and there's different medicine. But aren't a lot of the ways we are treating COVID-19 and the Spanish flu really in direct correlation right now?
Yeah, it's palliative care. It's palliative care. Yeah. So Tim is actually making interesting. He's actually making a really interesting public health point. The problem is, during the 1918 flu, I actually wrote it down. It's super interesting. So what did we have to treat the 1918 flu? I will tell you. So during the 1918 flu, the medications that were used included opium, beef tea, ammonium, aspirin, and quinine, which is when I was in college, I did a junior research paper on the history of quinine. Quinine is a super interesting medication and was used for a lot of things, including the 1918 flu. So essentially what we were using, and by the way, some of those things were probably counterintuitive and were not helpful. But during the 1918 flu, essentially what we were doing, sadly, is some of what we're doing now, which is basically palliative care. Because really, if you think about people who go to the hospital with coronavirus now, yeah, and they have a very serious version of it. If they don't have a serious version of it, as we all know, they're being told to go home, right? Oh, you might have COVID-19 or you have COVID-19, go home, right? And take care of yourself there. So we're not really telling them to do a whole lot more than we did during 1918. 1918, what did we not know? We really actually didn't know much about what a virus was. We didn't really know much about influenza and where it came from. We didn't really know a whole lot about bacteria. So we didn't actually know about these things, but what we did do, a la the very fabulous advertisement that Tom put up, was if you put a mask on your face, that's probably right, wear a mask. So people knew that much, even though it wasn't completely clear why it was proof against that. But really, in 2020, what are we doing for people with COVID-19? It's a lot of palliative care. And if it's not that, it's ventilators. And we've seen the numbers for ventilators, which are not wonderful once you're on a ventilator, especially if you have some comorbidity and if you are older, if you're elderly. So unfortunately, we're not doing a whole lot more for people with COVID-19 now than we were for people during 1918.
Yeah. And then Jared's one of the people that works in the healthcare system.
Yes,
when he tested positive, he said, I treated it holistically, vitamins A, B12, C, D, elderberry, apple cider vinegar, and zinc was what he used.
He used that at home?
I believe so, because I believe he was quarantined at home for a little bit.
Yeah.
So
I mean, it sounds like Jared was like boosting his immune system. That's what it sounds like he did.
Yeah. I mean, so now that there is a lot of, so now we're not trying to be alarmist with it, but we're just trying to compare, like, it didn't end in 2 months. And, you know, and when people started putting on, when we first had this discussion on March 18th,
almost a month ago.
Yeah.
It's not over.
We were like, this isn't 2 weeks. I was like, I had my prediction. I think you had a prediction. We don't want to deal with our predictions because you're giving us more of the statistical facts and then the things that people are seeing. So here's another Tim meme I'm going to bring up. If masks work, why can't we use them and get back to work? And if masks don't work, why are we being forced to wear them?
Right. If masks work, why can't we use them and get back to work? They don't for that reason. And if masks don't work, why are we being forced to wear them? To protect other people and not ourselves. But it's a fabulous question, by the way. And I think a lot of people also were caught off guard by the fact that when we first entered the era of COVID-19, everybody said, don't use a mask, right? And I don't even have one to show you, but
Jared actually made a very, I didn't know this. He said, Jared said, FYI, I'm a respiratory therapist, Tom. That's actually what he does.
Oh my gosh, Jared. Oh, Jared.
So he's in the middle of it.
Out on the front line. I mean, and again, I was talking with a really good friend of mine who was saying, I don't really know why it is that we, okay, let me backtrack for a second. We spend a lot of time, as well we should, talking about the nurses and the doctors, and we should, and all hats off to them, and they are on the front line, so forth. But you know who's legit on the most front line, in my opinion, the most front line? Respiratory therapist. I mean, they're legitimately going in a room with someone with COVID-19, because everybody basically has COVID-19 now in the hospital, and they are doing the very hard work of trying to get these people to be able to breathe in a fashion that hopefully will limit their having to be on a respirator. And then when they are on a ventilator, these are the people that have to work with that. So that's just, I mean, the close quarters you have to be in and what you have to do. I mean, Jared, again, I'm not sure if I've met you, but if I haven't, I definitely, all my thoughts are with you for the kind of work you have to do. It's really incredible, and you are to be commended for what you're doing. That's real frontline work.
Yeah, he said literally 2 feet from their faces as we
No, that's
intubate
what I'm
them.
saying. I mean, if you're respiratory, I mean, you're right there. I'm like at my computer like this. I mean, you are right there if that's what you're doing, and you're doing it with like dozens of patients several times a day. You're not. It's not like you see one patient, you leave. You see that patient 2 times a day, maybe 3 times a day, and you're in their face. It's just it's stunning. So I'm my thoughts are with you, Jared. They really are.
So now I'm just going to bring this up because this was another fact that I wanted you to fact check and tell me if it was true or not. But they had brought up a coronavirus deaths by county. So
Yeah, this is accurate. I live in Queens. That's where I am now. I'm looking at the lovely Dogs Neck Bridge, and Queens was in not a great distinction to have right now, but they were in first place for several weeks, and then Brooklyn took over for a little while. Now the Bronx is taking over, but this is accurate. I mean, if you notice the main, I mean, basically 1, 2, 3, 4, 5, 5, 6. 1, 2, 3, 4, 5, 6. 6 of the 10 counties are downstate New York. One might as well be Essex, so that's Newark and so forth. And the rest are hotspots that we've heard of. So yeah, it's a mess. I mean, it's really challenging in terms of the numbers for New York, and that's why if you look at, and we're going to get to this stat in a minute, but if you look at the country and you include New York, it looks, because New York is on such a downward trajectory now because of all the social distancing and people staying at home and people doing what they need to do. New York, the curve has shifted and now we're on a downward trajectory. So if you look at the New York numbers and you do not include New York in the overall United States numbers, the country kind of looks pretty good. It's like, oh, it's kind of stable. When you take New York out of that, the numbers for the country, the other 49 states are going that way. And I mean that way by up, because New York has been such a feeder for the death rate and the COVID-19 rate that when you remove New York, who's basically doing a pretty decent job of getting their numbers down, and you look at the rest of the country, well, the numbers are going up.
But all right, so now John Noto chimed in and he said density, it makes all the sense. So do you think it's just because of density, or do you think that the rest of the country is just lagging behind because it hasn't really started making its way through it? Like, what are your ideas on like Georgia opening, for instance? Because they are a good test.
Yeah,
for the rest of our country.
So I think he makes a good point. So one issue is density, just the sheer volume of people living on top of each other. Another one is that New York is a hub, right? So if you figure that the coronavirus came from either Europe or China, and it's now looking like, based on the research, the strain of the coronavirus that is impacting on New York is a European strain. It is not a Chinese strain. So if we figure that the strain that is impacting on us is a European strain, and we also figure that the possibility is that there were earlier diagnoses of COVID-19 in Europe, then we would have to extrapolate from that a big factor in New York having such a large number of cases is probably that there were a lot of people who flew in from Europe to New York in December and January and February. And that by the time we realized the coronavirus was a pandemic, you had thousands and thousands and thousands of cases already in New York. So yes, I think the density is an issue. I think also the fact that New York is a hub, and the fact that lots of people fly into New York as a first destination from Europe, and the fact that because people fly in from Europe, and Europe appears to have had very early COVID-19 cases, and the strain of COVID-19 is a European strain, then that is why New York and Newark, by the way, people like to fly into Newark Airport. So Newark Airport and LaGuardia, well, LaGuardia is not it's a domestic flight, so take LaGuardia out. Newark Airport and JFK or hubs for people flying in. So that's why you probably have large numbers in Essex County.
So Keith Rogers just chimed in. He said, "Didn't it start off on the West Coast first, though?"
So that's a really, really, really interesting point. So there's a really great documentary that's called Coronavirus, A Tale of Two Washingtons. And it tells a story, and I highly recommend it. Miles O'Brien is a great reporter who's a seasoned veteran and knows his stuff. And it premiered a couple of weeks ago, and basically tells of the really, really compelling story of patient one. So you always want to know who patient one is. So patient one for the United States appears to be a patient in Seattle, Washington. Now, here's the thing. Interestingly enough, the good people of Seattle, Washington in February did several drills specifically for a flu-like pandemic. Wrap your head around that for a minute. You should just let your head think about that for a minute. But they did. And so when patient one manifested in Washington, the state of Washington, that state was prepared. They were ready. So they had a whole protocol ready.
I hate to cut in on you, but so now we're getting a lot of feedback from people. So now they said, Vinny Benami says, is the European strain on the East Coast only? So was the first patient in the U.S. over there still a European strain, or was that a Chinese strain?
Okay.
And go ahead. Sorry.
Right. Okay. So a little bit unclear, right? So patient one in Seattle potentially could have been a different strain, potentially. So when patient one manifested in Washington, there was a complete, amazing, awesome system in place in Washington where they essentially just got this guy. I mean, even the suit that they put him in, it looks like something out of Star Trek. But essentially, he was even transported from where he was to the hospital he went to in a special suit for people who are highly contagious. And then they basically just completely had a system in place for how to deal with this patient. Okay.
And they had contact tracing. That they were able to see where he would have passed it throughout.
They worked on contact tracing. They worked on how he was dealt with in the hospital. They worked with the federal government and the Trump administration very carefully in terms of how to work with that patient. It was actually a pretty decent effort. So if you notice, the state of Washington has cases. They don't have the cases like what we just presented
with the density. So now John Noto chimed in. He said we will never know who patient one was. I know a lot of people that were sick in December with similar situations. He thinks this was here since November. What's your take on statistics and facts with that?
The timeline of COVID-19 seems to continue to go backwards a little bit. So now we potentially maybe have a case of a patient in France. Tom and I were talking about this before. There's potentially a case of a patient in France who presented with COVID-19 the end of December, which means he would have been infected mid-December, which then makes us think that potentially there were cases in Europe in December. Again, if we extrapolate from that people travel and they circle the globe and so forth, one obviously could surmise that potentially there were cases from Europe or from other parts of the globe that were here sometime in December. That's not something.
Yeah. So I'm sorry, I'm going to keep throwing this in only because for some reason I'm not getting our comments across to us. But Mike Bloomfield chimed in. He says the dates keep getting pushed back. We can't even believe when it started in China. What are your take on the information? Because that's what you do. You collect information and study it on the China information that we had from them.
I showed this last week. I'm going to show it again. And I know it's not on our chart, but I think it bears repeating. I wrote something else on it. It's here. Basically, so you guys just saw, Tom, could you for a moment just put back the chart that we had about the United States and all the states and what their numbers charts look like? Any of those charts, it's fine. It doesn't matter.
Any of them, okay.
Yeah, exactly. Okay, everybody see that? So just take that in for a second, okay? Just look at it for a second. Okay, now we can turn that off because I'm now going to show my little book.
Okay, you got it. Sorry about that.
Everybody see that? This is China.
that is China. That is there.
That's China, people. China says we had 80,000 cases, boom, then we had none. Now, based on what you just saw with all of those states, does anybody see a similarity between that and all of the charts you just saw? I personally don't. So then if we take from that, the China with 1.3 billion people, 1.2 billion people had 80,000 cases, and then that was it. But yet somehow the United States, we just can't get our act together. We're just, whatever's going on with us. And so we have all these thousands and thousands of cases, but we can't. Then I think we have to say something is amiss. And I don't think it's the good people of the United States.
I agree. I totally agree with that. But out of all these countries, whose patterns are we following closest?
You mean in terms of other countries? Unfortunately, nobody's. We're so, our numbers are, I should have put this up, but there's a really great graphic of the cases in the world relative to ours. And we're unique. We're unique. And again, I think a lot of that has to do with the fact that we are these 50 states. So each state has their own story and is doing their own thing. And so we're almost, a better analogy for us would be to compare us to Europe as a whole, I would say. So look at the United States and look at Europe and sort of compare it that way. I think it's hard to compare. And again, we're not a homogenous country. We're made up of a lot of people from lots of different races, Black, Latino, Asian. So lots of different races, lots of different ethnicities, lots of different populations. We have large homeless population. We have lots of populations that make us sort of unique. And so I think that makes it a little challenging in terms of comparing us to a specific European country or, the African continent obviously has a very different story, which we can think about at some later point. But I think in terms of the outbreak, the European countries are the ones that it's interesting to compare us to. And I just don't really think there's a great comparison.
Got you. And then what Keith Rogers chimed in, what about all of these inaccurate numbers of deaths that are being reported? Do you think they're inaccurate from your statistical perspective, because you have been following all of this and then fact checking it?
I don't know which way Keith means inaccurate. I would say inaccurate because there are way more deaths than are being reported. So again, there's a really interesting fact from New York looking at the number of daily deaths over the last couple of years, and then looking at the number of daily deaths in 2020. And the number of daily deaths in 2020 versus the number of daily deaths for the last few years consistently is about an 8-fold increase. So what that says to me is, and again, by the way, things like heart attacks and strokes and appendicitis, they've all disappeared from hospitals. There's none of that's there anymore. So nobody's coming in to the ER with heart attacks anymore. Nobody's coming in with, all these emergencies. Admittedly, car accidents have gone away too because nobody's driving. So, that's actually a beautiful, wonderful side effect of COVID-19 is that people aren't dying of motorcycle accidents, they're not dying of car accidents, not in the numbers that they were because people aren't driving motorcycles, they're not driving cars. But in terms of deaths, I would say that there are a significant number of people who aren't getting to the hospital because they don't have COVID-19. And there are a significant number of people who are dying at home, either from COVID-19 or comorbidities from COVID-19. So they already have a heart condition and they get COVID-19 and they're dying in their sleep or they're dying at home. So the death numbers are, I would say, vastly underreported. And the number of people who are dying at home from COVID-19 is not being reported in the way that it should be.
Okay, so now here's a good question. So Mike Bloomfield brings something up. He gave a great video that we will watch and go over in a later episode. But he said Republicans believe the death count is too high. Dems believe it's too low. Who should we believe in that?
I mean, I feel like I just gave a decent. I have this conversation every time we do this, which is I feel like I'm decently apolitical. I mean, I don't. Other than Tom, I don't know that many other people really sort of know where I stand politically on anything. And I don't think I run around bashing anybody.
Either way, absolutely.
I don't know that anybody really would be able to say,
I think he's asking, do you think that the numbers, from your statistical standpoint, because this is really where you have your highest expertise, is right, in epidemiology, and to be able to say where the facts do lie. So do you think the numbers that they're reporting, do you think they're too hot, they're over-reporting them, or they're under-reporting them? Or do you think the numbers are numbers?
Low. Well, it's not even too low. The death numbers are literally the numbers of hospital deaths and nursing home deaths. Cuomo says that very clearly. He says it very so. Yesterday there were 306 deaths in New York, the state of New York, and 270 were in hospitals and 36 were in nursing homes. That's it. Those are the COVID-19 numbers he reports. So obviously they're too low because he freely admits the only numbers they're reporting are hospital deaths and nursing home deaths. If you died in your home from COVID-19, you're not in that mix. You're not in that mix on any level. So they are too low because we're not reporting any deaths. The numbers we get, the number of deaths in New York are hospital deaths, nursing home deaths. That's it. So they're too low. They're just too low because we're not reporting deaths in home. So they're obviously too low.
In Dom's house. Okay. And then Vinny Benami made an excellent point.
By the way, we're not reporting people who are home.
Sorry, go ahead.
We're not reporting people who died of COVID on 49th Street. We're just reporting hospitals and nursing homes.
Gotcha. I didn't know that. I didn't know if those were that's how the death.
That's how we do it every day. So every day Cuomo goes through and he's like, these are number of health deaths in the hospital. These numbers deaths at nursing homes. Here's our number. And then freely admits, he's like, we're not counting anybody else. So the two
not the accurate number.
No.
So now Vinny Benami made a great point. He said, this part of the problem we face, it's always one side versus the other. This is the first time we as America haven't been united during a crisis, which leads us to a great stat. So Heather sent me this stat, which was amazing. So now these are the numbers from deaths in different world wars and war conflicts, and the American deaths from the 1918 flu, which we were comparing these two to, because 1918 seems to be presenting very similar to this one, not necessarily in the exact amount of deaths, but like for the first 2 months, if we look at the graphs, it's not too far out. We're actually a little higher, right? On COVID?
Right. Yeah. So, it's unfortunately like higher. It's higher. And you know what's interesting about the comment you just said is even during the 1918 flu, we weren't united because the reason why a lot of people died during the 1918 flu, well, not a lot, but the reason why some people died is because of neglect. So people were so stigmatized because of the flu that people were left in their homes, and people died of starvation, and people died of neglect. So I would say another time that we weren't united was during the 1918 pandemic, which is sad because, again, the reason why we're doing this show is to talk about learning lessons from the past. And if we really want to learn a lesson, one of the lessons we should learn, which I think we're doing a better job of, to be honest with you, now than back in 1918, is to try to come together and help one another, and help people, and make sure that, our neighbors and our families are taken care of as best as we can. I mean, I think obviously there's, the ultimate in us coming together was 9/11. And I actually wear this bracelet every day of my life, which is a bracelet for a first responder, police officer Alphonse Niemiter, who died during 9/11. And I wear it basically as to remember his sacrifice and the sacrifices of all those who died on 9/11. And so for me, I know that 9/11 was a moment when we came together as a country, and it was the best that we had for all of us. And so
I agree that was a tremendous unifying event. We were able to all come commonly. I don't understand how we're not able to come together, no matter what your perspective is. This is a common enemy. This isn't something that's going to decide if you're a Democrat or Republican or this religion or that religion.
But that's the thing. You said it. It's a common enemy. And I don't know that everyone really sees COVID-19 as a common enemy, especially with some of the memes that we put up and, really trying to overcome a lot of people's beliefs that it's 5G or that it's, a China lab. I mean, I personally, again, I say this with all humility as somebody who is a public health professional. At some point, I really do want to figure out exactly where it came from. I really do. And we just need to know. But in the here and now, it would be nice to know that we could all come together and say, this is not a disease that any of us want. And we need to all work very carefully to make sure that none of us get it.
Absolutely. I agree with that. I think that's the thing we're trying to spread more than anything. So we're getting a ton of comments, and I apologize that I can't pull them all up, but
well, that's nice.
Yeah, Vinny Benami said 1918 flu. I can't really speak of. I'm old, but I'm not that old. But 1918 was such a different time, medically, educationally, and all. But we are using the same methods to treat, right? Not to treat, but to hopefully we can end it faster. And Mike Bloomfield makes some great points too, because when we were discussing all the wars, I'm going to bring that graphic up real fast again. And he was saying, don't forget that World War I was 2 years. World War II was 4 years. If we left this virus unchecked, how many people would we have within a year?
Who made that comment?
Mike Bloomfield actually made that comment.
Well played, Mike Bloomfield. Exactly. That is a great comment. Right. Yeah. What if again, I can't emphasize this enough. The only reason we're having any sort of impact on COVID-19 in New York is because of all the measures we're taking. And the thing that makes me still scratch my head is that even with everything that we've done, 2 days ago, we still had 306 deaths. And so, interestingly enough, Governor Cuomo created a task force to look specifically at why is it that even though we're social distancing and we're supposed to be staying at home and we're not supposed to be going anywhere, that we still have 306 deaths. And it's really interesting. It's not as obvious as you would think. And a lot of it has to do with people coming into our homes. So not that people are leaving their homes or not that they're using public transportation. That's actually not it. It's that people are visiting us. They're coming. So I think some of us, you should all think to yourself, when was the last time I had a friend come over to visit me at home? If it was within the last 2 months, then that's potentially part of the issue. So thinking through, what am I doing that potentially exacerbates the problem, that makes it so that this continues? Well, that potentially is one of those things. So it's very interesting to think. I love that comment because we are where we are, which is not a wonderful place because 360 of our fellow human beings died 2 days ago. But we are where we are because of what we've done and what we will do tomorrow. But if we didn't do those things, and if we hadn't done those things, where would we be? I mean, it would be completely catastrophic. It would be completely catastrophic.
Okay, Harmony Dela Cruz, who's one of ours, actually just said CDC says it's not contagious after 14-day quarantine, yet my cousin was just in the hospital 2 nights ago for it. She's a nurse. Doctor told her she can shed it for 37 days, but they want her to go back working in the nursing home after 14. What is your take on that?
So there's an interesting study that came out that looked at how long COVID-19 lives in our orifices, our throat being the most obvious one, but also our nasal passages. And potentially it can live up to 38 days. And there was another really interesting study that looked at, I think I mentioned this on our first cast, maybe, or maybe the second one, looking at that horrible cruise ship to nowhere. Remember the cruise ship that just kept going? And they looked at how long COVID lasted on surfaces, and it was weeks. So again, there's a lot about this disease that we don't know. And there's a lot of outlier cases. Additionally, there's the question of whether or not people who've had COVID can get it again, which is unclear. And
that's a great one. I actually wanted to bring that up. Oh, no, wrong one.
Yes.
Somebody had actually put that up as one of the memes, and we wanted to address that. So it says, scientists conclude people cannot get coronavirus twice. Now, since you do study the facts and the peer check things, is that true? Did science conclude that you can't get it twice?
No.
But that right there is the problem with social media. So people,
I mean, I hope that we can't get COVID-19 twice. I really do hope that. That would be wonderful.
I hope it too, but it's not something that is proven as a science and proven at this point.
No, yes. Because the reason why we're not sure about that is because we're not sure as to how long your COVID-19 antibody lasts if you have had COVID-19. So, I mean, COVID-19 has been with us for a few months. So let's say you have an immunity to COVID-19 for 187 days. Okay, what happens on day 188? Can you get COVID again? I don't know. Maybe. So then that would belie the statement that we just saw. Because if you have an immunity to COVID, but it lasts for 6 months or a year and a half, then once that year and a half is up, potentially you could get COVID-19 again. We don't know. And I think that that's a really powerful statement to say we don't know. Because to me, anybody that makes declarative statements about COVID-19 right now, I would question that.
Absolutely.
There are certain things that we know to be true about COVID-19. It's a disease. People get it. It has certain factors that we know are true. But to make these declarative statements like we'll have a vaccine in 2 months, or you absolutely definitively can't get it twice, or if you test positive for it, then you can never test positive for it again after you have it. Those are not statements that, I mean, I would personally be willing to sort of dig my heels in and say they're true.
Absolutely. Vinny Benami actually just said, wow, 38 days. So what happens when we open up? What is your opinion? I don't know either. Like, we're not giving things our opinions too much, Vinny, but we're giving the facts that we know on this. So what is your take on that?
I am concerned about us how we would do it. And I actually feel fortunate that I live in a consortium of states, like you mentioned, Tom, that are being decently cautious and careful about what that looks like. Because I would say that, I mean, COVID-19 is going to be, I'll say this real bluntly, COVID-19 is going to be with us until we have a vaccination for it. It's just going to be. Will it be in the same rate that it has been the last few months? No. But will it go away completely? No. And I mean, you know, some sort of speculate that COVID-19 for the next couple of years could turn into something similar to the seasonal flu, where, you know, October, November, December roll around, boop, you got the flu and you got COVID-19. So, I mean, that's actually sort of an interesting theory, and it's possible. But in terms of when we open up, I mean, I personally wouldn't want to be the first one at, you know, a Mets game Okay, I'm a Mets fan, so
Me too. Me too. We just let out something about ourselves. We're both Mets fans.
Yeah, exactly. Let's go Mets. So I'm a huge Mets fan, 86 Mets, and my favorite player is Darryl Strawberry. So I'm a huge Mets fan. But let me tell you, even with all that, as painful as it normally is to go to a Mets game, even I would not be at a Mets game first one out the gate there. I just, so I think people individually have to ask themselves. I mean, this is a question I ask my students all the time. If somebody told you tomorrow the bars were open and you could go to a bar and hang out, would you go? I think the vast majority of people would say no, and they probably have a.
I don't know about that. I might disagree with that. I think the vast majority of people right now, if you gave them carte blanche to do what they want to do.
Why don't we ask? Yeah. How many of you would, if the bar is open tomorrow, how many of you would be in a bar tomorrow?
Absolutely. How many out there in the crowd? Let us know how many would go to a bar. Thank you for that, Top of Owner. We appreciate you, Vinny. Thank you. And let us know if bars were open. We're actually going to be. I'm trying to keep it to an hour.
Oh, okay.
But I would like everybody to comment in the comments, because next week we're going to try and do this again for another hour. I love that we have so much information. We have so much engagement. And please, if you have questions or you have something that you see, make sure you give it to us, and we will give you the true data. Todd said, "What about fall sports season? Do you think fall sports season?" That's very questionable. We're not really giving opinions as much as we're giving like true facts on it. But what do you think, Heather?
No. No, only because we're in May now, June, July, August. I mean, so these players have to get ready, right? And so that's a decent amount of, doing that and so forth. But even if they're just going to like waltz onto the field sort of as they are, the thing I keep coming back to, which is why I asked the bar question, is if we said, yeah, NFL is open, how many of you would go to a football game in September? I mean, how many people would go? Maybe everybody would go. I don't know. But I think that's a big issue in terms of not even so much from a public health perspective. That's the perspective I look at, I just think now we're so sensitized to crowds. I know myself, when I see TV shows now and I see people in large crowds on TV shows, I went. I'm like, oh my gosh, don't they know about COVID-19? Oh wait, it's not a TV show.
Okay, here's a very big thing that I've seen on a lot of social media. So John Odo chimed in. We don't even know if it's a hot or cold disease. Is there such thing as a hot or cold disease?
I mean, again, I believe what he's talking about probably is diseases where, there's a lot of speculation as to why the African continent hasn't had the numbers that they have. And I think a lot of people are speculating. And again, I'm not a speculator. So I think a lot of people are speculating that, it's warm climate and so forth. I mean, I think COVID-19 has decently shown us enough curves that I think it behooves us to not make assumptions about what it's going to do. Yeah, normally like the seasonal flu is called the seasonal flu for a reason, because most people don't get the flu in August. They get it during the season when the flu strikes. So I think people are kind of hoping that COVID-19 follows suit with that. I mean, we'll see. It's May. So let's see what happens during the summer. I don't think I'd want to see what happens taking off all social distancing. So just saying, hey, it's summer, let's all just go out there and live our best lives and assume that COVID-19 and ultraviolet rays will kill it. So that's not a chance I would personally want to take. But for better or worse, we have certain states, I'm looking at you, Georgia, who essentially are doing that work for us. So we can all watch and see what happens to a place like a Georgia or Texas that is lifting some restraints. Let's watch. We don't even have to do anything in New York. We can just watch and see what happens.
I think that's a big deal. We're lucky enough to have other states that want to be the test state.
They sure do. They
God bless them. Yes. But as we were saying, the numbers aren't proving, they're not panning out to being favorable for those states as of yet, right?
Yeah, Georgia's numbers are not going down. Let's put it that way. They're not going down. They're going in another direction other than down. That would be up.
Yeah.
So they're not going down. They're not going down.
But then people make, I don't want to go. We're going to go super late. But Todd asked for a quick wrap up of what we've spoken about. So basically, what we have gone through, we've been done a little bit of the contrast and comparison to the 1918 flu. I'm just going to bring these up one more time because people are like, "Oh, it's such a different time. It's so different." But if you take a look at this ad could be used today. Okay. This is the same ad. This is not an ad from 2020. This is an ad from 1918 when they were battling another flu that was rampant, when they didn't have herd immunity, when this is what we were looking to do. So wear a mask.
You know what, Tom? So Governor Cuomo today announced a mask PSA contest because his daughters told him that he's not the best communicator. They told him that. They're like, "Dad, you're not the best communicator. You need to get some sort of PSA out there so people can know why they need to wear masks." I legit want to send that ad in and see what happens. I feel
Let's do it. I do. I think we could send that in. It would probably be just as relevant today.
He's kind of wearing a mask.
Absolutely.
So, but I think but it's not, I mean, to your point, the ad that you found about masks, which I love and I think is great, you could totally use it today. Like, you could absolutely use it today. Why not?
Absolutely. And then that other ad said, the only reason I know it's from 1918, it says, "Stop the spread of influenza and tuberculosis." Right. Otherwise, we could use that too. Let's just cut out the tuberculosis.
TB is still a thing. I mean, it is still a thing, but it's just not a thing in the way it was.
Way it was, where it was taking people out left and right. So we have made leaps and bounds, and I think we're going to beat this as well. It's just we need to beat it together on a smart, taking the right track to it.
Correct. Agreed. Correct.
But I appreciate you so much. I can't wait to do this again with you next week. We're going to field as many questions as possible next week. I'm going to get this down a little bit better.
We didn't answer that we can answer next week.
Yes, please, guys, make sure you send in your questions, send in your social media posts, your memes, whatever is out there. Please send it in, and please ask questions and share this word. We're looking forward to helping out everybody and giving real information. We can't really do too much about giving our opinions, but we're happy to give you whatever facts we can give you to confirm or deny things that you see people post.
I just want to say I really appreciate people like Tim, for example, and Jared and Keith. I mean, we need these kind of questions. We need people to be engaged. And to the extent that they are, I appreciate them fully. So keep the questions coming, keep the thoughts coming. And I mean, I'll be here to engage. I know Tom will be here, but I actually think it's fabulous. And I love the discourse and the conversation that people are having. So we need more.
You know what I love? I love that I know a lot of the people that have chimed in, I know personally, and I know some are very Republican, some are very Democrat, some are very this, some are very that, but everybody can have a conscious conversation together. And I think that's what this is all about. We're trying to give a space for a positive, conscious conversation where we're not being divisionary. We're trying to conquer this as a team together. And I think that's really what we're trying to create here. So every Wednesday night, you can catch us here doing this.
I would say at the point that you feel that either of us, which this is not our personalities, but either of us is somehow alienating people from their ability to be able to do that, then we have taken a very bad turn somewhere. And I just don't see either of us going that way. I want the opposite. I want people to feel that they can discuss these issues and we can answer whatever questions. No question is too anything to answer here. So bring it on.
All right, guys. Thank you so much yet again. And this is my socially conscious piece every week. Me and Heather are going to do this every Wednesday night. We're happy to have some people on and answer every question possible. We hope to see you. Make sure you check us out playing poker. Make sure you check us out drinking exorbitantly on other nights of the week because we're still here for an escape. And please tune into a bunch of the other casts. Gotham After Dark, I think, is starting right now, so you can go catch that. Thank you, everybody, for tuning in. We really appreciate you. Thank you, Heather. I appreciate you for being here with me.
You're the best. You're the very best. Thank you.
Thank you so much. Thank you, guys. Have a wonderful night yet again, guys, and we will definitely see everybody next week.